Okay, everybody, I guess we'll get this press conference started, and I want to take this opportunity as Minister of Health and Wellness in the province to thank everybody for coming here to launch this very important strategy, a strategy to prevent and mitigate the opioid-related overdoses and deaths in Prince Edward Island. I want to acknowledge some of my colleagues that are here. I see Tina Mundy, Minister of Family and Human Services, and Sydney McEwen is here too, representing the opposition office, and I know his new boss, James Aylward, was here earlier for some briefings on the subject. As obvious, I guess, in all of the media, we had the issue yesterday where Donald Trump actually was involved with an announcement regarding the opioid issues pertaining in the U.S. So I hate to always be following Donald Trump on any particular issue, but I can assure the people here that we have been working on this particular strategy for some time, and we're very pleased to be announcing it here today. So, and I also want to acknowledge our Chief Public Health Officer, Dr. Heather Morrison, is here, and our Dr. David Sabathie is also in the back of the room there, providing moral support. Anyway, and I guess the other thing I was going to mention too is that I'm just back from our Ministers of Health meetings in the country in Edmonton last week, and we met with Federal Minister Jeanette Petitpas-Taylor, and I can assure you that this particular subject was the predominant discussions throughout those 2 days of meetings, and as much as in Prince Edward Island, we're probably not in the same level of challenge that some of the other jurisdictions, especially more from the west as it's moving east. We have to take advantage of what knowledge that they've had in those jurisdictions and apply that so we can focus on a much more preventative role and preventative nature when it comes to opioids and their abuse in this particular province. So anyway, across this country in the past year, opioids have taken the lives of thousands of Canadians. We are fortunate that here in Prince Edward Island, the impact of illicit fentanyl and opioid deaths has been minimal, but that doesn't mean that we need to be complacent. As a province, we have a responsibility to protect the health and safety and well-being of Islanders today, and we are proud to be presenting and releasing PEI's first ever action to prevent and mitigate opioid overdoses and deaths. Our comprehensive approach to this crisis will hopefully not only save and help save lives, but will also help diminish the impact that these drugs are having on island families and entire communities. Opioids are drugs like oxycodone, hydrocodone, morphine, fentanyl, and carfentanil. When medically prescribed and used properly, opioids can be very beneficial for a patient requiring pain management issues. But when opioids are misused, particularly in the combination with other drugs, they can be deadly. Potent opioids like fentanyl are also being hidden in other illegal drugs without people knowing. The key to success in this challenging situation is collaboration. We must continue working with our health providers, law enforcement, and community partners, keeping Islanders safe and to prevent the spread of opioid abuse across Prince Edward Island. In this particular case, we have a team approach here, and we certainly want to commend some of the other departments involved here, the Department of Justice and Public Safety and the RCMP with law enforcement and other law enforcement agencies in the province. But a team led by our Chief Public Health Officer, Dr. Heather Morrison, and the Department of Justice and Public Safety has spent the past few months doing consultation and research, and they have created this particular action plan to prevent and mitigate opioid overdoses and deaths. The action plan will focus on 4 areas: provide tangible recommendations on how we can better support Islanders and save lives. And the areas of focus will include enhanced surveillance so that we have better understanding of what is happening on PEI, rapid response protocols, so if a crisis arises on Prince Edward Island, we know exactly what to do and how to respond, harm reduction, including access to naloxone, communications and education in opioid replacement therapies, and collaboration on opioid supply, including appropriate prescribing, dispensing of prescription opioids, and diversion of these medications. This is a major step forward to protect Islanders and ensure safer communities. As I said before, collaboration is the key. Many of the stakeholders in this room have been part of many focus groups. I've participated in it myself. Staff met with frontline workers, community organizations, prescribers, and with individuals with lived experiences. The result is a very well-crafted action plan, including 9 strategic priorities and next steps in how we can achieve those priorities. Some of these actions have already commenced. This past summer, the government initiated a pilot take-home naloxone program and is providing naloxone kits and education to users for needle exchange programs. We have already created partnerships to enhance surveillance of overdose and deaths, and within our opioid replacement therapy program, we've added new medications so that clients can benefit from now either methadone and Suboxone. We are making great progress in the fight against misuse of opioids, but we know that there is more work to be done. Before I hand the podium over to our Chief Public Health Officer, Dr. Morrison, who will give us a much more full and detailed overview of the action plan, I want to thank the leadership team and the task groups who led this particular work. You all did a tremendous job, and for that I certainly thank you for your dedication to this file. The plan outlines actions we can take to make a difference in the lives of so many people who are struggling under the weight of these particular drugs. Opioids are becoming more widely available across Canada, which is why we have taken action now before this does become an actual crisis in our particular province. We know this is a great deal of work ahead of us, and life-saving work that we feel is very paramount to the importance of Prince Edward Island. Without further ado, I'm going to turn our podium and microphone over to Dr. Morrison to present the specifics on the action plan. Dr. Morrison?
Thank you, Minister, and I actually think you did a great job outlining the action plan. Welcome to everyone and to the media, to the Minister, and to Sydney from the opposition, our deputies here, and also to people who were involved on the leadership committee as well as the task group. So thank you for being here. Substance use and misuse right across the country has been a significant problem, and that includes opiates, but it also includes alcohol and other substances. And many families and communities, as the Minister mentioned, have experienced devastating effects of problematic substance use and misuse, and that includes, of course, opiates. You know, opiates are used for severe pain. They are a drug usually prescribed for pain, but they do have varying potencies, and they do have addictive properties. What we've seen is in certain parts of the country, particularly in Alberta and BC, an increasing number of opioid overdoses and deaths. And these have largely been associated with the distribution and infiltration of illegal drug supply with fentanyl and other substances like carfentanil. And given that trend of what's going on in other provinces and the impact of opiates across Canada, PEI and all the other provinces and territories have initiated the development of plans to respond to and prevent issues related to the use of opiates and overdoses. I'm going to I realize I think I have the clicker. Excuse me. There it is. Okay. So this is from 2016. There were 2,800 deaths, apparent opioid-related deaths in the country, and there were 5 opioid-related deaths in PEI. All those 5 deaths were of what we call mixed toxicology. So they had 1 or more opiates plus 1 or more non-opiate substances. For instance, they would have an opiate plus alcohol or opiate alcohol and a benzodiazepine, and fentanyl was detected in one of those mixed toxicology deaths here in PEI. In 2017 to date, we've had less than 5 overdose deaths related to opiates. So I think it's important to mention that this action plan is building on some things that have already been going on and some very positive things that have happened. PEI is very fortunate to have a drug information system already in place. And that means that if you have a prescription filled, for instance, at one pharmacy, they can tell that you've had that prescription if you try to go and get it filled at another pharmacy. It's a comprehensive system right across PI. It's used by prescribers in hospital, outside of hospital, by pharmacies and prescribers. So I think that's a really positive thing. The other thing that has happened in the last number of years are the methadone and opiate replacement treatment clinics. And these are in Montague, Charlottetown, and Summerside. And methadone and Suboxone as a replacement prescription or replacement opioid for people who have addiction issues with opiates, they have increased. But while those numbers have increased with the introduction of these clinics, there's been a decrease in seizures of our pills right across the province, which reported by police and RCMP. So that has been a very positive thing as we have opened those clinics across the province. The other thing that we have here, the needle exchange program. There are 7 sites for needle exchange in Prince Edward Island, right across. And these are really part of a harm reduction approach. And I think those have been really important part of harm reduction in PEI. And the other thing that happened in 2013 was the Narcotic Safety and Awareness Act was passed, which has been important to have that in PEI, so it allows us to actually use it to put a monitoring prescription program in place. So in terms of the Opioid Action Plan, as it went forward, really the leadership, it feels like it's been a lot longer than just really a few months, but the Opioid Leadership Committee was formed, co-led by Justice and Public Safety and our office in the Department of Health. And then 3 task groups were developed, and they included a task group on surveillance, one on harm reduction, and one on collaboration on opiate supply. And the people in these task groups and leadership committee included police services, EMS, physicians, prescribers, dental association, college of physicians and surgeons, and a wide variety of people. And then in the summer, we actually went out for consultation, and the consultation included community organizations and also service provider organizations. In addition, we had one-on-one interviews with people with lived experience, and I think that was a really important part of the consultation and provided some valuable input, not only for the action plan, but that input will be used as well in more implementation going forward. So that part all contributed to the development of the action plan. And it really had 4 areas of focus, as the minister mentioned. And I'll just touch on each one of those as we go through opioid-related overdoses and death surveillance, the rapid response protocol, harm reduction, and the collaboration on supply. But underneath all of it certainly is the importance of pain management and education and early intervention for youth. And we heard that throughout the consultation, that those 2 areas were important. So the first one about the opioid overdoses and death surveillance. There are 2 sort of different parts of surveillance, both equally important. And what we're looking at is unintentional deaths. So they are not intentional or suicide deaths that we're looking at. We're looking at unintentional deaths. And this information is coming from a combination of the trauma registry, the QEH laboratory information, poison control, and the coroner's office. And we're now we've started already. We have weekly reports of overdoses coming to our office, and we are going to have quarterly reports, and we already have quarterly reports of the deaths. We'll see in a couple of slides, the web posting will start today, and we also are reporting nationally those numbers. This surveillance is important because it informs our rapid response, which is a protocol that we have to put in place that in the event of a sudden increase in our overdoses, that we want to be able to respond to that. So it's really strengthening the identification and coordination in the event of an increase in opioid-related overdoses and deaths. So for instance, if all of a sudden we saw an increase in 1 week of our overdoses, we'd be concerned that was there something that was an illegal substance that was being laced in some of the drugs on the street, and we need to respond. So how do you get the messages out to the right people? How do you get the messages out to the providers? How do you respond to any increase if we see that? In terms of harm reduction, I mean, really the priorities are about harm reduction education and communication. How do you enhance opioid replacement treatment delivery, and which has already started, but how do you enhance that? And how do you support access to naloxone to populations likely to respond to or experience an opiate overdose? So we've already started again. We haven't waited for today to start this. This would be, we started with a pilot through Needle Exchange about distributing naloxone kits. And these naloxone kits look like this. They have 2 vials of naloxone in them. And when they were given out through Needle Exchange, most of the clients or their families or friends who picked up the kits went through an education program and to learn and make sure they knew how to use the naloxone kits. And now we've already started increasing where that, so it's not just at Needle Exchange. We know naloxone kits are in the hands of RCMP and police. They are currently going out to the firefighters who are first responders across PEI. We have them going out to the provincial addictions facility and are in discussions with corrections and other treatment facilities so that they can be used in those places. The goal is to get naloxone into the hands of people who will need to respond to an overdose. Excuse me. And then finally, collaboration on opiate supply. So here we want to, as we mentioned, the drug information system is really a great thing to have here in PEI, but we want to initiate a formal prescription monitoring program, strengthen prescribing and dispensing practices, and also reduce diversion of prescribed opioids. And that's also really working with our justice colleagues in that regard as well. We have 2 additional recommendations, and again, I mentioned this earlier. These were highlighted through the consultation as well. So the first is the recommendation of a formation of a multi-stakeholder committee by December 2017 to look at pain management. And these areas for the committee to consider include access to pain management services, our patient participation in education, physician education on pain management, the adoption of opiate prescribing and dispensing best practice guidelines, and the adoption of pain management guidelines by prescribers. The other recommendation is around student well-being core teams, that they develop a plan for coordinated evidence-based approach for the integration of education on opioids into substance use programming, and to support early intervention for at-risk youth in partnership with stakeholders, including school community, police services, child and family services, mental health and addictions, and our community partners. And I think as as I know there's a number of us who have young children, so it's not just to protect our own children, it's to try to protect the children for all of us right across the province. And today we're launching a web page that is preventing opioid overdoses, and it is features information about the action plan, where to access naloxone, quarterly surveillance reports on opioid-related overdoses and deaths will be there, and links to related service areas. So I think this will be also helpful to have some of that information in one place where people can access it, both public and providers. Finally, in terms of where we go next, I think the issue, as we mentioned, about problematic substance use and abuse and our issue with opioids across the country is not new. And we want to try to address this. It will not, there's no immediate fix that will happen overnight, but I think this is a really good place to start. We've already implemented, as I mentioned, some of our plan has, in many ways, the free take-home naloxone program has started, and that rollout of the naloxone take-home kits. The surveillance has really been enhanced, and I think that will be important not only for opiates, but that cooperation and using the different data sources will help us in many regards. In terms of an implementation structure, we've already talked about what the implementation structure will look like, and we've committed to preparing 6-month progress reports on the action plan, so it doesn't just become an action plan without any updates on it, and these will be publicly available on a 6-month basis. And any implementation structure we've talked about already includes various stakeholders, including those with lived experience. And then really moving towards some of the areas that we've mentioned in the plan that we need to look at, establishing the prescription monitoring program and preparing a public prescription monitoring report, and working to develop a proposal for a uniform pharmacare program for opioid replacement therapy. So I think this is all together in one place, some good action for the province to try to prevent our overdoses and our deaths here. They have devastating impacts on families and family members and our community and our province. So I certainly hope we can do what we can to prevent it becoming the same issue that we see in some of the other parts of the country, and deal with it the best we can going forward to protect Islanders. So thank you very much.
Thanks very much, Dr. Morrison. Anyway, I guess I'll have to acknowledge Dr. Morrison. Actually, you played a role in being my deputy minister for a little while, but we also have our new deputy minister here, Dr. Kim Critchley. So I know Dr. Morrison is very dedicated on her file as Chief Public Health Officer, and was a great person to be working with. And I certainly want to acknowledge all the team that put together this particular strategy, and look forward to the implementation and the successes from that. I certainly also want to acknowledge that the many families that are struggling with the impact of addiction to illicit substances, and those too have lost a friend and family members to an overdose. And when I was out at the meetings in Alberta, I think they used statistics like there's like 3 to 4 people a day are passing away in British Columbia. It's a staggering number. So certainly all those Canadians that have suffered the loss of a loved one, we certainly our thoughts are with those individuals. We certainly also want to do what we can to prevent the loss of any more Islanders to opioids. And as a government, this is certainly a priority for us. And as a minister, I fully endorse this plan. And our department is committed to bringing a stronger partner and leader on the many of these types of initiatives. Implementation has already commenced, and on many of the action items that we have put forward here today, and every 6 months there will be a public report on the progress being made to prevent and mitigate opioid-related overdoses and deaths in this particular province. As I mentioned in earlier remarks, certainly collaboration is vital, and one of our major partners is our teams that are involved with law enforcement, as well as the Department of Justice and Public Safety. So for the media, if you're looking for an interview, Dr. Morrison and myself and others are available here, and we're happy to be here and available to you this morning. And I certainly thank you for all coming out today. And this is an extremely important file and an issue that can be a matter of life and death to many Canadians as well as Islanders. It is something that we do take very seriously, and we certainly appreciate your interest and support in this very poignant subject. Thank you.